Hi, I'm Megan Fowler. Today I'm going to be discussing the health disparities in parents who have children with disabilities. Specifically, I'm going to be focusing on parental stress in those parents who have children with disabilities and what can be done to help the parents in those situations so that there are less negative effects on both the parent and the child. First thing I'm going to be discussing is the research on parental stress. Children with disabilities are likely to be influenced by their parent stress levels. For instance, parental stress and other parental factors can impact how their children's treatment plans and programs are developed and how effective they are for the children. Another thing to note is that the interactions and the relationships between parents and children have an overwhelming effect on the progress that children with disabilities make in their therapeutic or educational endeavors. And parents with children with disabilities often experience higher levels of stress, regardless of the type of disability, compared to parents who do not have children with disabilities. Also, parents with disabled children reported having higher frequencies of depression, and they also report to have a harder time dealing with challenging behaviors in their children. There's also an increase in parental stress during the child's middle childhood. And by middle childhood, I'm referring to the ages between 3 to 10. So during that time period in the child's life, there seems to be an increase in parental stress in the parents that have children with disabilities. Next, I'll be talking about different evidence-based practices to help reduce the parental stress. The first is a family-centered approach, which educates the parents on their children's disabilities. It also exposes them to different resources that can be helpful for both the parent and the child. This type of approach also helps the parents in understanding the various treatment options or choices that can be made for the child to help them be successful in their treatment. And all of these different aspects of this type of approach help to reduce stress levels in parents, which again, in turn, helps the children as well. Another research method is through mindfulness-based stress reduction. This method is used for reducing stress in parents in general, but specifically it's been shown to help for parents with children of developmental delays. It's been used in that kind of context as well. And reducing parental stress through this type of intervention can result in a spillover effect, meaning that parent stress reduction can also reduce the child stress and also reduce their emotion dysregulation as well. There are also a couple types of assessment tools that can be used to help evaluate the stress of parents with disabled children. One is the Parental Stress Index, which was developed to assess the impact that parenting has on person stress levels. However, it's sort of a flexible tool that can be used to look at variables that may be predictors of high stress levels in parents who have children with disabilities. Another one is the Parental Stress Scale, and this has a similar function to the PSI, but with one added benefit. The scores on the scale effectively discriminate between parents of children with disabilities and parents of typically developing children. So this can be helpful for clinicians because it's a way for them to be able to give the proper resources to the proper types of parents and what they need based on that. Another thing I'm going to discuss is the recommendations for future research or future notice in the mental health field. The mental health clinicians and other professionals should take the time to check in with the parents of children with disabilities, even if the child is their primary patient, because if parents are having difficulties such as mental health concerns or resource concerns, then that will have an adverse effect on the child's home environment as well. So therefore, by helping the parent, you're in turn helping the child as well. Professionals also need to take extra care and attention towards parents during the child's middle childhood, again, that age range of 3 to 10, because there is that increase in parental stress during that time. So checking in with the parents then is also very important. And then just some local resources that can be helpful. One is the Dreams of Acadiana, which is based in Lafayette, and the other is the Families Helping Families, which is in the greater New Orleans area. Both of these organizations provide information, education, and other resources to those with special needs and the families of those of special needs. Thank you very much.